It's another day with the physicians where your health is our business. It's growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what do you know?
You're welcome back to the training author of your regular program.
So if a woman is diagnosed with breast cancer, what happens? Her world shatters.
From that message.
Yes.
Rheumatic heart disease is a condition in which the heart valves have been permanently damaged by one or several episodes of rheumatic fever, an autoimmune inflammatory reaction to throat infection with group A streptococci. The heart valve damage may start shortly after untreated or undertreated streptococcal infection, such as strep throat or scarlet fever. Rheumatic heart disease is the most commonly acquired heart disease in people under age 25. According to the World Health Organization, rheumatic heart disease claims over 288,348 lives each year, the large majority in low or middle income countries. It most commonly occurs in children in childhood and can lead to death or lifelong disability. Rheumatic heart disease can be prevented by preventing streptococcal infection or treating them with antibiotics when they do occur. Today on your favorite television, health TV talk show, The Physicians, we will be discussing rheumatic heart disease, the causes, the risk factors, the symptoms, presentations, and of course complications, then prevention. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your anchor on this program. Today we'll be discussing rheumatic heart disease. And in the studio with me is our guest, Dr. Niyi Bamikole. He is a consultant cardiologist with the military hospital here in Lagos and special interest in heart failure. Dr. Bamikole, you are welcome to our program.
Thank you very much for having me.
You're welcome. Thank you so much for coming.
It's really a pleasure.
Thank you. So we're going to be discussing rheumatic heart disease. For the purpose of our viewers out there, it would be nice if you tell us, just give us a general overview of the heart and where we expect to see this disease.
Heart is a special organ in the body. Okay. And like I said, it's the lifeline of every part of the body. It's the one that is responsible for pumping blood to every part of the body. So once the heart is alive and make the brain to be in a good position, the body is in a good condition. Yeah. So there are so many diseases that affect the hearts. But one we are talking today, rheumatic heart disease, it's a chronic condition which is caused by damage to the heart valves due to rheumatic fever. Rheumatic fever, it's an inflammatory condition which come as a result of infection of some set of bacteria which we call streptococcus, okay, group A to be specific. And when this infection occur in a younger age group between the ages of 5 to 15, it causes a kind of fever and some joint pain, scarlet fever, and afterwards it creates some autoimmune condition which can affect some tissue in the system. And one of the tissues affected is this heart valve. And once it affects the heart valve, it has tendency to cause a chronic inflammatory process in the heart valves, causing fibrosis, which can affect the function of the heart generally, and developing rheumatic valvular heart disease.
Okay, so you made mention of a word, autoimmune.
Yes.
What do you mean by autoimmune for the purpose of our people?
Autoimmune is the cells of the body fighting against itself due to some inflammatory process that are produced.
So the body fights itself?
Okay. Due to some antibodies that are produced against the body tissue. Okay, that is autoimmune.
So the body reacts and fights itself.
Fight against itself.
Okay, so now let's go to the basics. For rheumatic heart disease, what are the risk factors and possible causes? Because we already talked about the streptococcal infection. What are the risk factors?
The main risk factor is still this rheumatic fever, which develop around the ages that I mentioned, 5 to 15 age group. And the heart condition don't usually show up until about 10 to 20 years after the main infection due to this rheumatic fever. So that's the main risk factor. And rheumatic fever in our environment is usually due to low socio-economic condition, poor health facility, and over congestion of the environment, over congestion of the health facility that we have around. So that is the main risk factor that make individuals to develop this rheumatic valvular heart disease.
Okay, so you said about congestion of the health facilities. So you mean it's picked up from the hospital, the health environment?
No.
Really?
What I mean is that the health facility is not up to the standards. Okay, so the little one around, people get to assess it, and it's very, very stressful. Okay.
So when the person picks up this the infection, we'll definitely talk about the symptoms. You will not notice the problems, the challenges won't come up until like 10, 15 years after.
Most of the time.
So what are the how does a patient who has rheumatic heart disease present?
Most of the time, some of them are asymptomatic. I mean, you don't notice anything in them, and some comes with palpitation, feeling of their heartbeat. Some come with exertional dyspnea, maybe they were tending towards heart failure, and some can present in the case of emergency, especially when the valve of the heart got ruptured. So the presentation are in various level of involvement of the heart valves. Okay.
Wow. So is it easily recognizable? Because we talked about from sore throats, infection with the sore throat. So is it anyone who has a sore throat, if it's not properly treated, is it possible for the person to have that kind of once you begin to think about rheumatic heart disease in future?
Yes, you are right to some level, because the first infection of this streptococci can develop the autoimmune base immediately, or the recurrent infection. But the main thing is that once the heart valve is affected, it also depends on how bad the heart valve and the valves in the heart are affected. If it is a one that has already resulted in fibrosis, narrowing of the heart valves, then the symptoms ensue on time. But if it is the one that just affects a little area there, the person may not really have symptoms until later age or involved in a stressful condition.
So how do you make a diagnosis?
The diagnosis is based on the symptoms the individual presents with, then some laboratory tests which we need to do, especially the heart-specific tests, which include the electrocardiogram and also the echocardiogram. When we do the echocardiogram, we're able to see the valve that is affected. the commonly affected valve is in the left side of the heart, talking about the mitral valve and the aortic valve. Then you see some either fibrosis on the valve, which results in narrowing, or the valve is incompetent, which results in severe regurgitation of these two valves. So that's how we make diagnosis.
But diagnosis is made.
Yes.
Before we go to the management, how it's managed, is it usually, is there any age, is there any, let's say, more in the female or in the male?
Yes, it's
Is it,
like twice
okay.
more common in female than male. I guess probably due to the genetic makeup of the female. Probably.
Then how about the environment, the Caucasians or in Africans?
Yes, one of the risk factors that I mentioned the other time is low socio-economic environment, which you have infection coming around, then no access to health facility on time due to congestion of the health facility that is available is very little. So people are getting congested in the little one that is available, and they can't access health easily. No antibiotics that is around. The antibiotics that is around is not up to standard. Then people don't recognize that they have this rheumatic fever on time. They just thought probably it's ordinary malaria, take anti-malaria, not getting better. But before getting to the hospital, it already resulted in some valvular involvement in the heart.
Okay. So as a cardiologist and one who is actually on ground, how often do you see patients that have come down with rheumatic heart disease?
It's relatively common in our environment.
Seriously?
Yes, relatively common, both in the younger age group and also in the elderly, especially in women when they are under stressful condition like pregnancy, because the subclinical one I mentioned the other time, the one that are asymptomatic, when they're under some level of stress, such as pregnancy, that the heart need to do more work because of the baby that they're carrying inside, then the symptoms that is subclinical start to show up at that level. So it's common in the environment. And we have so many valve replacement patients or valve repair patients around. So it's relatively common.
So how do you manage them when they come to you?
The management depends on the level of presentation. I said the other time that most patients present with heart failure. So you manage the heart failure as the primary things that they are presenting with. Then the final management may involve surgery, going to go and repair the valve or replace the valve.
Okay. So you're talking about the management of the heart failure. So let's start from the presenting complaints of one who is in heart failure.
Okay.
So how do they present one who has a heart failure? What is the presentation?
Most of the time,
one can easily recognize it at home.
Yes.
If possible.
Most of the time, they present with dyspnea on the session. It's walking a little distance, having difficulty with breathing, easy fatigability, get tired easily, cough that are productive of frothy sputum, and sometimes they can be pinkish, especially when the lungs are overloaded with fluid. And sometimes they can have bilateral leg swelling, generalized body swelling, abdominal swelling, and eating the little food, they get satisfied easily. So we call it early satiety. Wow. And sometimes they can present with lying flat, having difficulty with breathing, or waking up just suddenly during the night, looking for a way to get air, which we call paradoxal nocturnal dyspnea. So these are the symptoms that heart failure patients present with.
So we'll just hold it there. When we come back, we'll deep dive more into this rheumatic heart disease. But you will now have to explain what it means, what the heart valves actually, what it do, so that people will be able to appreciate the work that the heart valve does, so that when it's infected, then we can now come down with the kind of challenges that they will come down with. Hold it there, we'll back. So to have just they will want to hear from you. What do you have to say about the rheumatic heart disease? Do you know somebody who is experiencing it, who has experienced it before? How about the presentation, difficulty in breathing? Let's just hear from you out there, and we'll be back after the short break.
here. My heart is located at the left side of my chest.
It's located in this part, the right part of the body.
No, I don't know of any infection that can affect the heart.
No, I don't.
Yeah, kind of. I heard of one, but I can't say the name actually. I don't know the name actually.
Oh, yes, I had the sore throat and the doctor prescribed strepsils and some other medication like ibuprofen or Tylenol. That was all.
I was told to use salt and warm water, and I was prescribed NCP to use. So afterwards, I got healed. Yes, I've had sore throats a couple of times, and I just went to the clinic and they gave me strepsils.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've been discussing rheumatic heart disease, the risk factors, the possible causes, the symptoms, and the diagnosis. We haven't yet talked about the management. And in the studio with me is Dr. Niyi Bamikole. He is a consultant cardiologist with the military hospital here in Lagos, and with special interest in heart failures. And he's actually been talking so much about this heart condition that is caused by a bacterial infection called the streptococci. Just little sore throats. You won't even realize that you have actually contracted the disease. And before we went to break, he actually talked about the heart failure, what it means, so that we'll be able to understand the presentation, the symptoms of this kind of a heart disease. So we'll go back to him. So Dr. Bamikole, you've talked so much about this rheumatic heart disease. But for the purpose of those who just joined us, maybe you want to give us, I want you to talk about the heart valves that this infection usually affects. But then just give us a general overview again about this rheumatic heart disease. Just give us a general overview.
Rheumatic heart disease is a common disease in a low socio economic countries, especially in this our environment here, West Africa, and it is really a chronic condition affecting the heart valves, damaging the heart valves because of previous rheumatic fever.
Okay.
And rheumatic fever is an inflammatory process occurring to the tissue generally in the body. But one of the areas it affects is the heart valves.
So what does
this stem up from infection from streptococci organism, a bacteria, which can affect the throat, presenting as sore throats, or affect the skin, presenting as scarlet fever. Most of the time, when you have the scarlet fever, you also have the sore throat. So when this develops, there is an autoimmune cells that are produced in the system, like the cells of the body are fighting against itself. So these autoimmune cells, which are the antibodies, they fight the heart valve muscle and heart valve tissue. And when fighting it, they damage it in a chronic way, which results in a chronic condition called rheumatic valvular heart disease.
So they have a liking for the heart valve. What does the heart valve really do?
The heart valve is a special tissue in the heart which prevents blood from either flowing back or going forward based on their function. And there are about 4 of them in the heart. We have the major one, which is the mitral valve, followed by the aortic valve, which they are on the left side. Then we have the tricuspid valve and the pulmonary valve. They are on the right side. Majorly, this condition we call rheumatic valvular disease, it's commonly affect the left side, though can affect the right side as well, but commonly affect the left side because of a predilection for the tissue there.
So of course, so if the heart valve is involved, you are going to have a lot of challenges with the flow and
so the flow can either be in a stenosed way, that means we call stenosis, or can be in a incompetent way, which we call regurgitation.
Wow.
And regurgitation means the blood is flowing back Stenosis, it can't flow forward. So all of them can result in symptoms, which varies from exertional dyspnea to overt heart failure. So.
So now I know our viewers out there, they would be wondering, we have heard so much about rheumatic heart disease, we have heard about the symptoms, we have heard about this and that. So they want to hear, how is this condition managed? So let's talk about the management. Because already you talked about it being the social, the economic situation, the environment, a lot of things. So how is this condition managed? How can we prevent it? How is it managed?
Let me start with the prevention.
Okay.
Prevention is much cheaper, easier, and better than cure, as the scientists will say. In the way of preventing rheumatic heart disease is to manage or prevent rheumatic fever. So it not developing at all is better than it developing and you managing.
True.
So
True.
in such a wise, having a very good and sound health facility, good environment that are clean and good access to clean water,
Yeah.
clean environment, environmental pollution is seriously addressed, can help to prevent rheumatic fever. And also when this fever develop, management of this fever on time, as at the time due, you have sore throats, you don't just keep on taking lozenges.
Is it contagious?
Really, it's contagious.
Wow.
Contagious. It's a bacteria. It's a bacteria. So it can be transferred from one
Person
individual
to the
to
other.
an individual. But it doesn't mean when it's transferred, you could develop the disease.
Yeah.
Okay? So when this bacteria infection occur in the system, especially in the throat or a scarlet fever, management on time, using good antibiotics that has potency to address this organism is very important. And when the rheumatic valvular heart disease has already been developed, if you're going for any surgical procedure, because one of the things that make it much more worse is when you are having on top of one infection, another one, leading to further damage. Wow. So if this individual is medicated with the prophylaxis, like you want to remove your teeth, you let them know that you are having this shortness of breath when you walk and you are being diagnosed with rheumatic valvular disease. Take an antibiotics before you do any surgical procedure that involve a microorganism shower into your system.
Sure.
So that is another way of preventing it. But when it has already developed, then visit with your cardiologist frequently so that you are being managed with the symptoms you are having. Like somebody that has abnormal heartbeat, atrial fibrillation, it has tendency for blood clots to occur in the heart, which can lead to either heart attack or brain attack, which we call stroke. So this individual need to be well anticoagulated, and the anticoagulant effect need to be monitored continuously in order to prevent this kind of issue. Then the symptoms of heart failure will be well managed, and if necessary, can be recommended for surgery to either replace the valve or repair the valve.
Okay. So what are the possible complications?
The complication of rheumatic valvular heart disease involve stroke, as I mentioned, involve arrhythmia, which we call atrial fibrillation, involve rupture of the valves, which can lead to sudden cardiac death. It also involves some other condition, which is mainly the heart failure.
Okay. Because the final words to our viewers out there, what do you want to tell them about rheumatic heart disease? Final words.
Rheumatic heart disease is a preventable, treatable, and well-managed disease. And having a good health facility, good hygiene, and visit to your physician when you notice any symptoms goes a long way to prevent this condition and to manage this condition in a good way. Thank you.
Thank you so much, Dr. Bamikole, for coming on our program.
Thank you.
And I'm sure next time we'll still call on you as a cardiologist to come and enlighten our viewers on other health conditions, anything that has to do with the heart. Knowing that you are a specialist in heart failures, I'm sure we'll need your expertise more to talk about it. So on this note, I want to say thank you so much for staying tuned with us as usual in watching our program, The Physicians, where your health will always be our business. Remember to follow us on our social media platforms, on Instagram, on YouTube, on Facebook. And if you want to be part of this program, our website is up and running. Just go there and complete the form, or then we'll invite you to be our guest. I remain Dr. Martina Agberie. Till next time, stay blessed.